Welcome to the overview of Acute Oncology, Module 1 of the Acute Oncology Trainer Series. This CPD UK accredited module will introduce you to acute oncology, the complex acute medicine oncology interface. Did you know that up to 5% of emergency admissions are cancer-related? Cancer patients are still dying of neutropenic sepsis, and spinal cord compressions are still being missed in spite of huge advances in chemotherapy. Are you confident of recognizing them early and managing them effectively? The Royal College of Physicians in London and the Royal College of Oncology identified the acute cancer care crisis way back in 2012 and recommended the training of frontline clinicians to make them aware of the unique complexities of the unwell cancer patient. The Acute Oncology Trainer webinar series will train you to identify the important cancer-related emergencies early and manage them effectively. As a London-based hemato-oncologist with over 20 years of clinical experience and 15 years of teaching experience, I believe that acute oncology training needs to be more robust among medical students and doctors, especially frontline clinicians. Acute Oncology Trainer is a high-impact global digital initiative to address the weakest link in the cancer patient's journey. Our mission is to train 100,000 medical students and frontline clinicians to recognize oncological emergencies early and manage them effectively. Acute oncology is a delicate interface between two important specialities, and errors can lead to delayed or missed diagnoses and unnecessary medico-legal problems. Acute oncology is a very frequently tested subject area for postgraduate or Royal College or fellowship exams. We can help you develop a cancer patient journey for your hospital. Use your creativity to solve unmet needs of cancer patients, or use one of our audit themes to gather baseline data. What is acute oncology? In simple terms, acute oncology is the management of the acutely unwell cancer patient. In other words, the complex and unique issues at the acute medicine oncology interface. With the increase in cancer cases worldwide, the number of cancer patients who present unwell to hospitals is increasing. Also, with the improvement in diagnostics and screening, more and more cases are being detected. Better treatment options, especially immunotherapy, means that cancer patients are living longer. Unfortunately, acute oncology continues to remain a weak link in the cancer patient's journey. You're all familiar with the typical acute medicine cases in medicine surgery and orthopedics. Well-defined pathways or management plans are in place in hospitals for these commonly seen cases. In contrast, acute oncology poses unique challenges to frontline clinicians who are not familiar with the complexities of cancer treatment. The care pathways are not well defined in many cases. Oncology is a complex speciality. There are at least 8 reasons why acute oncology cases can become complicated. Let's look at them in more detail. Oncology has multiple specialities within it. Medical oncologists administer chemotherapy, surgical oncologists perform surgeries, radiation oncologists organize radiotherapy, and hemato-oncologists treat blood cancers and perform bone marrow transplants. A patient can be under the care of one or more of these specialists at any given time. Oncology patients are frequently immunocompromised, therefore need combination antibiotics and for longer duration. Oncology patients may also have other conditions such as HIV, hepatitis, uncommon viral infections or fungal infections. Cancer treatments are expensive, and treatment may be delayed, awaiting funding or insurer clearances. The cancer chemotherapy and immunotherapy landscape is evolving rapidly. Newer drugs are being licensed all the time. Some of them have unique side effect profiles that frontline clinicians may not be aware of. Cancer patients and their carers are well informed about their serious condition and have access to patient support groups and other information networks. They may have other age-related or comorbidities that can interfere with cancer treatment. The duration of cancer treatment can be prolonged. It can range from 6 months, 2 years, or even indefinitely. The Royal College of Physicians of London publication showed acute oncology admissions were due to a new cancer diagnosis in 20% of cases, treatment-related complications in 30% of cases, and cancer-related complications in 50% of cases. This explains why a good acute oncology service is so critical to avoid missing new cancer diagnoses and missing tremens-related complications. A rather simplistic view of an acute oncology admission is that an unwell cancer patient gets admitted to hospital, the trigger is readily identified, fixed, and the patient is discharged. But the ground reality is different. The unwell cancer patient can be at least 8 different points in their cancer journey. Undetected cancer, under investigations for a potential cancer diagnosis, recently diagnosed with cancer and awaiting chemotherapy, on chemo responding well, or they can be on chemo with an inadequate response, completed chemo on monitoring, relapsed and on 2nd, 3rd, 4th or 5th line of chemotherapy with a good response, or may not be responding, an alternate line of treatment required. It is important to find out where the patient is on this timeline, as the management varies. Let's